Well, hi everyone, welcome to our second episode of the Reframe series, and today's discussion is going to be around health. So we're going to be having this discussion with myself. I am Urpita, a researcher, artist, and filmmaker living in Los Angeles.
I'm Vanitha. I'm Arpita's cousin. I'm from New York State, and I'm here to add some wisdom.
Thank you. I'm Manu Multani, and I'm also in LA, and a PhD student in anthropology and social change, and also a filmmaker.
So we really wanted to just have an open discussion about our experiences with healthcare, and kind of as South Asians, we've encountered kind of what the challenges are with the healthcare system, both me coming from a first generation experience, as well as trying to navigate from how do I actually take care of and support my family, having had both a sick brother and now a sick father who has kidney failure. So a question that I wanted to start us off with was, what have our experiences with the healthcare system been like as South Asians? Vanitha Juji, I'd love to know. I'd love to know from your perspective.
Well, all in all, we've had some good experience and some bad experience. Early on, it was very difficult to get doctors to, how shall we say, maybe the accent was a problem, and it still remains to be a problem. So many times, even trying to get an appointment, you were sort of dismissed. You don't get called, your calls aren't returned, but eventually when you get in, many times you don't get that, the time's not given to you. Maybe some of your problems aren't that seriously. Many years ago, when I was 4 years old and sick in the hospital in North Dakota, Fargo, North Dakota, the physician who was assigned to me refused to shake my father's hand. So you can imagine how insulting of an experience that was. I mean, this was over 50 years ago, and I still remember this experience, this incident. So I will say things have come a long way, but there's still some issues we have to discuss and address.
Yeah. So for me, I've been in and out of the healthcare system all of my life because my brother had a genetic illness, a terminal illness, and so we were constantly going to the doctors. And now my dad currently has kidney failure, and I can say that we've been extremely blessed to have wonderful doctors and nurses who have really tried their best to take care of my family despite the cultural differences that exist between us. But it is often really challenging trying to navigate in that space. So as someone who is, I did come from India when I was 6, but I grew up here and I understand the culture, and I don't have the same language barriers as my parents and family members do. And I often will notice that there are definitely differences in the ways that we are dealing with the same situation. So I could, because I know how the cultural norms, and I also know, and I don't have a thick accent, I'm able to get better treatment when I'm talking to the administrators or dealing with insurance compared to my father. And I'm able to get my questions answered quickly, and I'm able to get to the right person, whereas he might be on the phone for much longer time, get passed on to multiple people because they cannot understand his accent, or really don't have, they don't have someone who can sit with him. And I understand from the health practitioner or the administrators and that it can be really frustrating trying to understand the language issues. But there are these challenges that do exist as a South Asian person in trying to navigate the system.
Do you guys want to talk about sort of what it means to navigate the healthcare system on our own, and what you sort of think is within a patient's right perspective?
Yeah, I think you have to kind of break down that barrier because you think that person's in charge and, I guess, for lack of a better word, superior. So you tend not to question that person's authority, but you have every right to express your view. And you shouldn't be afraid. You just shouldn't be afraid. And I think that's also, it would be appreciated by the healthcare practitioner, you know?
Sad, like when you're when you feel like your own physician is either discounting you or making you feel bad for asking questions, and not treating kind of belittling you for having your own ideas of how health works, or having questions about what he might be prescribing or how he might be approaching something. Which, yes, you are the expert. You are the one that has spent years practicing this. But I am a human being, and I'm coming here and putting a lot of faith and trust in you to take your guidance and advice. So I should be allowed to have questions and be able to be treated with respect. Yeah.
The other thing is maybe some of these healthcare systems, and maybe this is already in place, they need to have some seminars on cultural sensitivity.
Yeah.
Yeah, I think so. We also, I think earlier, Benita, you were talking about how South Asians are also not included in sort of research, and how our cultural nuances are not really included into medical school curriculums and things. So how do we sort of advocate for that, right? Because I think that's also another piece. I was sharing with Arpita recently that my brother had to go get some blood work done, and for his glucose level, I think it was, they had one, here's the range for a person, and then here's a range if you are African American. And it was different, right? And so now we're starting to really acknowledge that race and place has some sort of influence on your health outcomes. And so I think as South Asians, we also should be recognized to be part of that category, right? And that there needs to be more research on our culturally specific ways and how we sort of live. But yeah, I think, do you guys have anything to say about that? Or?
Well, there needs to be an emphasis on more research geared towards South Asians, especially we're known for heart disease,
Yeah.
diabetes. So this is very, very important. I know sometimes our anatomy is a little bit different, and we're lumped into one category, and that's very unfair. And it could be even deadly if the wrong dosage is prescribed to you. So this really needs to be addressed at the academic level. Research should be geared toward, there's certainly enough South Asians, and the research can be conducted.
Yeah. And there's also, even when it comes to dietitians, for example, my father has kidney failure, and if we are, and he is also a vegetarian, and when you have kidney failure, you have to eat a lot of protein, and there's this constant tension of trying to figure out, okay, what am I allowed to eat? What is a good and proper diet for me, given that I have these restrictions? And they're often very challenging to navigate, not because anyone is like doesn't have good intentions, but because they're, you know, the doctors and the nurses that he's dealing with don't have the same dietary restrictions. They don't have the same knowledge. And so he's really trying to he's walking on his own and trying to navigate, okay, what works for me, rather than having a more structured environment in which to operate with.
Yeah, like our food ways are not really well understood. And so how does that really impact how we raise our children, how we as adults navigate the world, how do we adapt to new places, because we're also an immigrant population. So yeah, I think all of those things are things to consider when it comes to determining, you know, what is the best sort of healthy pathway for us.
And even not all of us are immigrants, but we certainly are lumped into that category.
Yes, exactly.
Yes.
Yeah,
Yes.
that's definitely another issue, is like, because we look like foreigners.
We're treated as such.
Yeah.
Unfortunately.
Yeah. And that has its own implications and
Right.
power structures.
Right. I mean, just like the airlines have Indian vegetarian or vegetarian or vegan, I think some of the dietitians can be instructed on, you know, Indian vegetarian.
Yeah.
Especially because we are just predisposed
Yeah.
to diabetes. India is the diabetic capital of the world, sadly.
Yeah.
And cholesterol, you know, all of these
Cholesterol, high blood
Blood
pressure.
pressure.
It's that metabolic syndrome that works
things.
Yeah.
all works together, unfortunately. And they're measures that we should take personally. There's a lot of prevention that we ourselves can do, and we don't do it.
Yeah. And that's a great point too. I think that's also a good takeaway, right? Is that what are some of the preventative things that, you know, we should be doing? And exercise, you know, is like one of the things. I think we're starting to pick up on it. I think families are definitely recognizing that. But I think there's a I'll call it out. There's a gender gap. Women prioritize housework, at least from the families that I like navigate and are associated with, you know, and therefore their exercise and their time for their own care is not prioritized, and so they're not able to take care of themselves.
Yeah, and I think especially this is a really great point, in that Indian women, or South Asian women in particular, they often are not open about challenges that they may be facing. And so when they go to a healthcare practitioner, they may be reluctant to really share concerns that are happening for them, and they need that extra encouragement in order to really talk about issues. I've had similar challenges with my own mother, but I mean, we're able to navigate through those things. But I definitely think that for other South Asian women, where they're, you know, they may feel very self-conscious about bringing up these types of issues.
I would like to add, though, certain types of housework
Gives you a workout.
Yes.
Yeah.
you do
I
that
agree.
vacuum cleaning and you can sweat.
Yeah.
Go up and down those stairs.
Yeah.
Yeah, I said how you mop the floor really matters.
Yes.
I mean, you're stretching, you're moving.
Yeah. It is still mobility. Yes.
Yeah.
For sure.
So,
yeah. But I think there is.
right, it's true.
Yeah, it is true.
We were just having this conversation earlier.
Yeah, no, it is true.
Trust me, I get 5,000 steps doing housework alone.
Yeah. I believe you. I think there's something that I think the distinction really is, what do you want to do versus what you need to do, right? And then how does that really impact your health when you're making time for yourself, right? Like, sure, there's like this notion of self-care that's really popularized right now. I think to a certain extent, what the underlying purpose of that is, how do you really take care of your mental health, right? And how do you make time for yourself? And I think when you do things like housework, sure, it can give you the burn that you want, or the exercise that you want, and the mobility that you need, but at the same time, you're only doing it because you're trying to just get things done that need to be done because nobody else is going to do it. So what does that look like for you during your week? What does that look like for you during your month, your year? You know, like how much of your time is invested in doing things that need to be done versus for yourself.
And I'd like to add that once you start exercising, I started, I don't know, 20 some years ago. I mean, as a kid, I was very active, but I don't feel good if I don't exercise that day. It is, you become addicted to it. You know, like I can't start my day without doing certain, you know, stretches and running or swimming. So it makes such a difference.
It does,
And it's just the hardest thing is getting started. And it does take time to develop your routine and see what works for you, you know. So it's just a matter of taking that first step. And you can take baby steps. It really doesn't matter. And I would just like to add that you're really capable of taking a lot of things in your own hands. And it takes time. It's tough. It's hard, but whatever you can do, you know. And then of course there's family history issues. That's a whole nother
genetic disposition.
So, but as much as you can do on your own, you really should try.
Yeah, and I think there's something that's also about sort of, so it's like twofold, I think, in terms of really decolonizing your health. I think one is, yes, feeling courageous enough to recognize that there are things that you can do, but the environment around you may not help you do that.
Yeah, it could be stifling.
Right, and overwhelming. And so I think it's about really finding those sorts of cracks in which you can sort of navigate and find time for yourself. And that's a struggle. That's exhausting, you know, especially if you're a family that's doing 2 jobs, or if you're a parent that's doing day work and then somebody else is doing night shift, and then, you know, you're just trying to pay the bills, and that's what your structure is looking like. It's going to be very hard.
Or a single parent.
Yeah, or a single parent. Or if there's a language barrier and you don't know how to get resources, you know, and stuff. So I think all of those things really influence, and you know, more structures need to be in place for people to find time for themselves. That's definitely true and far extending. And then I think the other piece, our system's also, you know, ironically structured around giving people guilt for not doing certain things, right? And so it's not I think that's also in a way a radical act, is that you're going to do something for yourself, and if you do it, or if you don't do too much of it, not to feel guilty about it. Because I think that's also the reason why exercising for a lot of people is also very stifling, right, or overwhelming, because they think they have to do it for 30 days, or they have to do it an hour a day, or they have to be like eating right, or whatever right is, and also exercising for an hour every day. So they create these sort of like difficult scenarios, and then if they fall off of the train that they've created in their head, then they start feeling guilty, and then we're even worse than we started, because now you're managing your stress for that and all that.
Exactly.
Right, and so it's like a cycle that you can technically fall vulnerable to with the systems in which we're living in. So I think that is also a radical act, to be like, I'm not going to feel guilty. I'm going to choose to be happy the way I am, but I'm also going to find things that are good for me to do, and then figure it out from there.
Right. This is neither here nor there, but I recently had an appointment with a specialist, and well, I was very nervous. I don't know why, and so he was 45 minutes late, which is fine. I completely understand. I had no qualm with that. My problem was with the fact that as I am asking questions and I'm trying to discuss my problems with him, he kept checking his phone. And while I didn't say anything during the appointment, when I got the bill in the mail, I called the office and I said, well, first I called the office to complain because I thought this was very unprofessional behavior. If there was something he needed to do, all he had to do was say, excuse me, I'm going to take this call or look at this text outside, which is fine. But I called the office and I complained, and then when I got the bill, the copay, whatever it was, I said I refuse to pay this copay because my problems were not addressed professionally.
Yeah, and that goes back to the conversation we were having with Jimmy too, right, earlier, is
Right.
that you should make use of the grievance process when you're encountering problems within the healthcare system.
Actually, which leads us to, I think, a really good point, which is that when, as South Asians, when we are dealing with these types of challenges, we should really take on the knowledge of how can we have our grievances addressed or acknowledged by the healthcare system. Because if we are not the ones that raise the issue, it will never be addressed in the system at all. It will just be assumed that this problem never existed, and then it will be ignored until at some point in the future someone raises it. So the more that we can take it upon ourselves to report or even just share and make people aware of this issue, the more we are likely that to in the future have it be addressed. So just, I think having that knowledge is really important.
Yeah.
Because I think we all come, like, especially as South Asians who are coming from other countries where we are used to other systems and we don't know how to navigate in a brand new country, and we don't know how things work. It's often very easy to just assume that because this is the way that we are being treated, that this is the way the system works, and we'll never be the ones that change it. But one of the benefits of being in the US is that there are lots of these services available, and there is a constant focus on growing and improving and becoming better. And so wherever we can to be able to share these concerns is really important. And not to say that the impetus is always on the patient to do to be the one that does the reporting, but just to say that we can, there are spaces and we are allowed to. We don't always have to hold it in. Yeah.
The church agrees too.
Yippee.
Yeah. Yeah, I think, and I think some of the ways that like healthcare systems have been addressing this gap is writing out, language specific forms and things like that, right? I know in the North Bay, it definitely, you see Punjabi or Hindi forms that are available.
Oh, wow.
But it's like, that's, we're there now, right? Like, so it's like we're being acknowledged. So it's now it's in our own hands, unfortunately, to be demanding. That's essentially what we have to do, is like we ask for it over and over again. And that's the only place you can, is in the doctor's office.
Yeah. And also, I just want to say, as a researcher who studies populations and demographics as part of my job, it's really important for hospitals as well as city planners and policymakers to take into account the populations and the demographics who actually live within your communities and neighborhoods, and to try and proactively think about ways that you can accommodate them, whether it is simple things like having forms in different languages if you know that there are a large number of patients of a certain population that are within your community. And those are things that don't require you to have an extensive knowledge about a certain group in order to accommodate them. There are very, very simple things that can make it easier for people living in your community to be able to access and work with you.
What are those simple things?
So it can be surveys in multiple languages. It can actually be
The census.
Yes, for example, the census. And then hiring people who live in those communities or are part of those communities to be part of the system and take advice and guidance from them. Really listen to the concerns that they're raising because they are the concerns of their own communities. and encourage them and foster their growth and leadership, because they will ultimately help you to guide you and be able to act as a bridge to those communities.
I think, it's also as an individual who is using healthcare and stuff, that seems so far out of my reach, right? To be like, oh yeah, you should have a focus group of this community, or is there this opportunity where I can sort of share? I think what we really want to sort of focus on here is really think about how our own experiences are valid, right? And I think that's also what we're trying to do, right? Is that we want to make sure people think and understand and can feel strong enough to say, yes, my experience is valid. These are the problems that I'm having. I don't care if we're in a hierarchical structure, but I'm going to challenge this and I'm going to talk to you about it. And I think that's fair, and demanding a language interpreter, for example, is one thing too. Is that I'm going to have this appointment. I don't care if you have an appointment, but you should know I don't speak English, so you should have the capacity to bring a language interpreter ready for me when I come to you for a meeting, right? It's also the value of time, right? How we've been talking about that, and then that also can feel like not warm, not helpful, discouraging. I'm not going to come back to you. Why would I take care of my health with you? Like, then you're in this like other zone where you're just like, okay, I could have to deal with something that's timely, but now because I've had this bad experience, now I'm 7 steps behind because now I have to find somebody else and go somewhere else and establish that care. So I think the validity of it is also very important.
Yeah, and like the dehumanization of that experience can like really turn you off and actually reduce your health in the long run, because if you feel like you're not being treated well, then you're less likely to utilize the services in the future, and you may not have issues that are really important addressed for long periods of time because like you didn't just normally and frequently go to a doctor and make it part of your normal healthcare routine.
So I don't know about you, but I have been always requesting a female OBGYN. And I think, especially because of this one experience. So I was in grad school and I was trying to figure out what birth control and stuff I should be taking. And I went to this physician, and the physician was laughing at me. This white fella was laughing at me when I told him, I was like, this birth control is making me feel crazy. I was like, this is not, I don't feel balanced. I feel angry all the time. And he was laughing at me. And I was like, I never want to see you again. This is not helpful, And so since then, I've been I want a person of color and I want a female. Otherwise, I'm not seeing this OBGYN. So I've been definitely indicating that. And I think that's really important. And I started sharing this experience with some of my other girlfriends. And they were like, yeah, I totally feel it. When I take certain hormone specific birth control pills, I feel crazy too. And another friend of mine was like, yeah, I was throwing towels down my stairwell and I had no idea why I was doing this because I was feeling so off from taking this birth control medication. And I think that in of itself also it shows so many things, right? I think it shows, one, our medicalization of reproductive health, sexual health is so far behind and hasn't been improved, doesn't take into account cultural differences or nuances, and just makes it so much more challenging for people like us who are trying to fit in within the parameters that were created for white women, for example. And how we actually, even the birthing experience in of itself is so archaic, and you're tied to 7,000 different tubes and stuff and lines, and you're trying to push and you're trying to do all these things. As a doula, I know that is not the experience that I would want to have if I was going to give birth, So I think all of these things are things that we all live through and acknowledge and just kind of pass through the time, but don't really step away from them, or even do have these thoughts but don't know what to do with them. right? Is that, oh, that experience actually wasn't that great. What do I do about it? You're just sort of like, okay, I'm done with it. Why do I have to deal with it? Now I need to go on with my own life, you know? So I think those are sort of the challenges too, is that we just don't know what to do with information when we feel like we've had a bad experience, right?
Yeah,
Yeah.
that's so true. That is so true.
Yeah, it was like that experience just, didn't make me feel good.
Oh God,
But-
I can't imagine.
Yeah.
But you know, so at USC there was the gynecologist, and there was like a huge incident with a lawsuit where this gynecologist was accused of sexually harassing several women who had gone to see him, and you're saying that as like an individual, right? But
Yeah.
in a system that
Yeah.
could happen so many times,
Right.
over years and years,
Yeah.
and never be acknowledged,
Yeah.
or treated with the seriousness that it deserves.
Yeah.
Just
Wow. Well, does USC? I mean, they must have some female OBGYN.
They do, but I think the point that Arpit is also trying to make is that we all sort of consistently have an experience, but we can't sort of name it, or we don't think that it's a bad experience, or it might be just unique to us, and we don't know like what system processes are available to us to actually say, no, this wasn't positive. This is how detrimental it was. It was the opposite of what it's supposed to be like in a healthcare system. And so when only at such a gravity something happens, it's too late because harm has been done to so many people.
yeah.
Right? Yeah.
And also the power structures in place to address those issues, either they weren't used, or if they were used, that those kind of complaints were just brushed off and put aside for that number of times until it became such a huge issue.
Right.
Yeah.
Would you like this off now?
Yeah. The Me Too movement has definitely given a lot. So it's like, that's definitely a direct demonstration of what it means to sort of come together and organize and feel powerful within the numbers that are around you, that are also sharing these experiences.
Thank you for joining us for the second episode of the Reframe series. If you found this interesting to listen to, please give it a like, leave a comment with your thoughts, and subscribe for more interesting content. Thank you.